Hello and welcome to the Dental Expert Advisory Series. Kent Harlan with Ozarks Capital Funding. And today I have the pleasure of interviewing Debbie Seidel-Bittke, owner of Dental Practice Solutions. Debbie is a veteran dental consultant with many years of experience in the industry. Debbie, it's good to talk to you today.
It's good to talk to you, Ken.
Well, Debbie, how about telling us a little bit about your background in the dental industry?
Way back in the late 1970s, I worked as a dental assistant, and while I was working as a dental assistant, I went to school to be a dental hygienist. It was my lifelong dream to be a dental hygienist. And in 1984, I graduated from the University of Southern California in Los Angeles. And then I wanted to give back. I just loved being at the university and a part of the students and education. So I went back to work at the university for many years, and I was a clinical assistant professor in the dental hygiene department. And then I wanted to share more of my practice knowledge because I worked as a dental assistant way back when, and so I went back and also co-taught the practice management course for the senior dental students alongside of Professor Jack Connolly. And then in 2000, I started my own dental practice management company, which you know of as Dental Practice Solutions. And since 2000, I've just been able to help many dental offices reach their full potential.
Well, that's great. It kind of leads me to my next question. You work with practices across the country to enhance their hygiene programs. Do you typically notice there's an underutilization of these types of services?
Well, that's a great question, Kent. I sure do. Every time I do my initial assessment, I find at least 20% of the practice's patients have early signs of periodontal disease. And the periodontal exam, when I'm looking at the office charts, what I see them be well, first of all, a lot of times I don't see them documenting a periodontal screening exam on a regular basis. And what I see is that when they do chart, it's maybe 5 millimeter depth, which is starting of periodontal disease, and I'll see BOP, which means bleeding on probing, but they're not really intervening with some scaling and root planing or some non-surgical type of procedures to prevent disease. And in the 21st century, we are about prevention and early intervention. It's not waiting and watching.
Well, do you find that many dentists view hygiene as type of a loss leader or a service they have to offer rather than look at it as a profit center?
Kent, for many years, the hygiene department has been looked at as a loss leader. And I'm sad to say this is a true statement still today for many dental practices, but it doesn't have to be that way. It should no longer be thought in this manner.
You think it's because they're kind of leery about telling a patient they might have a disease later on and deal with it now? Or
Well, my experience has been many offices don't want to scare the patient. And then I've also trained and worked alongside of hygienists who were concerned about the patient's finances. So we have research and scientific knowledge to base our diagnosis and our communication to our patient on.
If a hygiene program is being run in an optimal manner, what general percentage of total production should it encompass?
Well, Kent, when the dental practices utilize a six-system approach, they can tap into more profits from the hygiene department. And this can mean about 40% of the production comes from the hygiene department.
What strategies do you employ to help the dental office get to that level?
Well, as I mentioned earlier, in my assessment with dental practices, there are quite a few assessments that need to be completed at specific intervals with the dental hygiene patient. There are numerous preventive measures which can be utilized during the dental hygiene appointment, and this is what can add at least $30,000 annually, U.S. dollars, and then our systems, the systems of Dental Practice Solutions, teach offices about recommending, as you might call it, same-day services. It can possibly mean another $30,000 coming from the dental hygiene department annually.
You can also work with dentists on maximizing patient case acceptance. In general, what are some of the things practitioners can do to overcome objections the patients may have when presented with a treatment plan?
Well, I have developed an 8-week communication strategy which builds upon the patient's barriers, their personality, communication style, etc. I personally show offices how to chart this out, and this information that's charted begins with the new patient phone call to the dental office. It's the first time that the patient calls the office, and there's a specific form, and it goes deep into not only what is your name and your address, but also we are writing down what do we think is their personality style. The office learns how to gather important information about the patient's language style, personal situations. For example, during the appointment time, maybe the hygienist will note that the patient has a daughter that's getting married or brother that's graduating from college. Also, we note personality type and then categorize their treatment plan according to the patient's needs and their barriers and their personality style. For example, if a patient has 2 or 3 areas in the oral cavity that need to be treated, the treatment plan can most easily be presented that day of the diagnosis. But when there's a treatment plan that's anywhere from $2,000 to $9,000, there's a specific strategy for consulting with the patient. And if the patient has a treatment plan that's $10,000 or more, it may take a few consultations, and possibly it could be a few years that we're talking and communicating with that patient about this larger treatment plan. This strategy that I've designed outlines and brings the dental hygienist into a partnership with the patient at their future appointments so that in the near future the patient's ready to schedule those larger treatment plans.
Okay, and I'm sure that there's probably some financing plans available too that you can present to them, which gives them an opportunity to make monthly payments, might alleviate some of the stress.
Yeah, thanks for bringing that up, because I do recommend that they have some third-party payers available, and when the patient needs to be talking about finances, I have a certain protocol for privately discussing this in a consultation room and recommending some of those third-party payers.
Ozarks Capital Funding is the only source you will need for dental practice financing. We offer loans for practice acquisitions, equipment, renovations, and working capital. Check us out at dentalpracticecash.com. Be sure and tune in to part 2 of my interview with Debbie Seidel-Bittke as she gives further tips and strategies on how to maximize profit at your dental practice.